If your QLs are relaxed, you should be able to do what I'm showing in this picture. You should be able to stand on one leg, reach forward and touch the other toes, and breathe and not hold your breath. When the QLs are relaxed, you'll be allowed to do that. Now, QLs and other back musculature, but this video is more about the QLs. If you can't do that, if you can't even reach forward, that means your back is too tight, and this video is for you. The Quadratus Lumborum, or the QL muscles, are often overactive for two primary reasons, and these two primary reasons really go together: loss of diaphragmatic breathing and pelvic instability. And when you lose diaphragmatic breathing, you will become unstable over time through your pelvis, or if you become unstable in your pelvis, you will over time lose your ability to diaphragmatically breathe, particularly on the left side. And this video is how you can at least get started to restore that process of diaphragmatic breathing and pelvic stability so that your QLs will relax. So when you look at this picture, here I am standing in right stance, and you'll see that the right side of my body, everything is compressed. So that right QL, which attaches to the ilium, the top of the pelvis, and the bottom ribs, when you're compressed on that right side, the right rib cage moves down and the right ilium, the right side of the pelvis, moves up a little bit. That's called right stance. That's what should happen if you're on your right side. In that position, you'll usually see a higher left shoulder and a lower right shoulder, and that's pretty typical presentation of this pattern that we're talking about of right dominance that the Postural Restoration Institute calls the left AIC, right BC pattern. This is how people come in to see me all the time. In that position, because of that compressed state, that right QL muscle is in an exhaled state. The whole right side, when you exhale, things compress. In terms of if you exhale for a longer period of time than just a normal breath, if you just breathe in and out, normal tidal breathing as they would say, exhalation is just a return back to its starting position. As you exhale more, things start to compress. So if you elongate your exhalation, your rib cage will start to depress and go down, back, and in. That's what's happening on the right side. Everything on the right side is getting compressed. The rib cage and the pelvis are coming closer together on that right side, and everything, now this is my right side, but over here would be your right side. That whole right side is being compressed, and that's the state that the right QL is in. So how do you start to get the right QL to relax? You have to decompress the right QL. So if your right rib cage is being compressed down onto your right pelvis, you need to open that side up. So you put yourself in a position that the left side has to go down and the right side would then have to come up. That's called being on your left side. That's called left stance. We're not very good at left stance. That's the whole underlying issue. We're right dominant humans with a bigger right diaphragm and a brain that likes us to be on our right side. That's why 90% of the world is right-handed, and the vast majority are going to kick with their right foot also. Laterality. The right side is the dominant side. So we like to compress the right side of our rib cage and the right side of our pelvis together. That holds us over there, which is fine if we can get to our left side when we should be on our left side. When we're walking and moving and put our weight on our left leg, that should switch. But when it doesn't, the right QL is going to be overactive, and the only way to get it underactive, or not underactive, but to return to its normal state is to lengthen the right side of the body and compress the left side. So if you look at the position that I'm sitting in this position, I'm sitting on my right hip. And when I'm sitting on my right hip, the right side of my rib cage and pelvis are moving further away from each other, and the left side and left rib cage are moving closer. So as I breathe in through my nose and out through my mouth, so I'll go like this. So here's my right side. When I breathe in through my nose, I'm trying to get air to expand the right side of the rib cage. You would feel stretch through here on the right side. Somewhere it could be, you could feel it up in your pec minor. You could feel it in the intercostal muscles between the rib cage. You could feel your right abdominal wall. You could feel your right lower back where the QL is. All those areas need to open up with air for us to be able to get to our left side appropriately. So in this position, we are directing air into the right side from your vantage point into this side over here so that we can exhale through the left side and get the left ribs to do what the right ribs are already doing. Remember, the right ribs are already compressing. We need to decompress the right ribs and learn how to compress the left ribs. we're always going to have a deficit of left rib compression, of left side compression, because again of the difference in these two diaphragms. The bigger right diaphragm loves to compress our right ribs. The smaller left diaphragm does not have as much oomph, does not have as much power to compress the left ribs. So that's the number one issue right there, is breathing. And in that state, when you stay overly compressed on the right side for too long, the left side, because it never gets to compress, becomes very unstable. And 90% of people that come in to see me have an unstable left hip. I'm going to get to that, because that will tell you why the left QL gets overactive and tight and painful. But one more thing, if you look at the side lying rest position again, when you see a right knee that cannot lay flat, that's due to an overactive right inner thigh and an overactive right lower butt. So this stretch, I did a video on it. I don't have a picture of it, but here's the thumbnail for the video. That's the position you would get in to breathe, and you should feel a stretch in the back of your right hip, your right butt area, and possibly your right inner thigh also. Highly recommend you watch that video though to understand why you're doing these just doing random exercises and techniques without knowing why doesn't make a ton of sense. There's a lot of mindless stuff out there. This is there's way more thought that goes into this. Remember, you have two halves of the body, and the right side and the left side are not the same because we're not symmetrically designed. So you can't treat the right side and the left side the same way. So if there's a stretch for a QL, they just say QL stretch, do it for both sides. No, because the right side and the left side are not tight for the same reason or overactive for the same reason. And you're going to see why when I talk about the left side. The left QL gets overactive because of, again, instability through the femur, through the left leg, and its attachment to the pelvis. And also, when you're unstable in that position for too long, you're going to lose your ability to breathe with your left diaphragm, because the diaphragms, and the left diaphragm and the right diaphragm, they rely on stability of the pelvis, the position of the pelvis, and stability of the spine and the rib cage, and the position of the spine, that rib cage, for its proper domed position. The diaphragm is in a domed position. When you inhale, it descends. When you exhale, it goes back up. But the attachments of that diaphragm on your lumbar spine and the inside of your front ribs, that dome depends on the proper position of the pelvis and the rib cage. So when the left pelvis moves forward into this left AIC pattern, if you want to call it an anterior pelvic tilt for now, you can do that, but it's not really. It's a total systemic issue. It's not just the pelvis. When the pelvis comes forward into what we call this left AIC pattern, the left ribs will usually flare. They'll flare up. And what that creates is lower back extension. And that's what this picture is. You'll see this picture is thoracic extension. When someone's lower back is extended on that left side, you know that they cannot breathe with their left diaphragms because their back is too arched. They've lost position. They've lost position of the left rib cage and left pelvis, which the diaphragm depends on. There's no stability there. So thoracic extension, when someone is thoracically extended, they're not going to have stability through that left hip, and they're not going to have the proper position of the rib cage. They're going to lose their diaphragmatic breathing capabilities. At that time, that's when the left QL will start to kick in as an inhalation muscle to help you get air in, because you've lost the main driver of inhalation, which is the diaphragm. If you find this video interesting, could you like it, subscribe, share, comment, whatever it's going to be. Thanks. Now, how do you know that the left pelvis has become unstable? How do you know that the left side of the pelvis has come forward into this pattern and the left lower back has arched? Well, you're going to watch a little video right now testing this individual. His left leg does not go down, so I know his left hip is forward. His left pelvis is rotated forward. In that position, when you have a pelvis that's forward on the left side, now I'm going to have him come all the way down. Oh, I do a straight leg raise also. He's got a tight left hamstring. His tight left hamstring is not because the hamstring is tight. It's because it's trying to be used to stabilize things. Now, in this part is how you know you have a front of the hip on the left side. That left hip should not go all the way down. So when you see that left leg go all the way down on a pelvis that's in a state of flexion, that's hip extension. This hip on the left side is in a state of flexion. If you're living in a state of flexion with the hip, the left hip should not have full extension. If it does, it means the front of the left hip, through here, the front of the left hip, the ligaments that hold that leg inside the hip joint itself, inside this acetabulum, has been stretched out. And that's pelvic instability through the left side. And when that happens, you're going to have to tighten up elsewhere. And what are you going to tighten up? Your left lower back, your left hip flexors. Your left hamstring may also get tight, but not always. But either way, when that happens, those combined muscles keep this pelvis forward and keep you over on your right side. So that left side instability, once it's there, it becomes the driver of holding you on the right side and then keeping the right QL overactive. Because your brain is saying, I'm not going to let you put your weight on your left leg correctly, so the right QL never gets to let go because your pelvis never turns to the left. The left side of the pelvis never moves back. If it can never get into that proper left stance position, your left QL is going to start to become overactive to help stabilize the pelvis. It's going to become overactive as an inhaler muscle because you can't inhale anymore with your left diaphragm. And also it's going to get overactive because the right QL turns the spine, the lumbar spine, to the right. And now this left QL is getting stressed out because the lumbar spine is constantly going in the opposite direction. So that left QL gets overactive because of loss of left diaphragm, pelvic instability through the left side, its overuse as an inhalation muscle, and because the lumbar spine is always being turned to the right, it can't fulfill its duty. It can't get you back to the left side. So it becomes angry and cranky and it starts to hurt. So how do you get started on getting the left QL to relax? Well, first of all, because you're in a state of extension, the pelvis is forward and the ribs are flared, definitely on the left side, maybe on both sides. Because you're in that position, first you have to get into a state of flexion. This spine, which is forward and the ribs are up, this spine has to learn how to move back. So you have to get into a state of flexion with the spine, and you have to bring your pelvis backwards into a position to get your pelvis and rib cage closer together in the front, and then you have to get air into the back of that rib cage to open it up with air so you can learn how to restabilize your body in that position. So I made a video about this. Here's the thumbnail to that video, but I'm just going to show you a little snippet of it, but you should watch that video because it also goes along with hip flexor inhibition, how to turn off your hip flexors. Because remember, the hip flexors and the QL are tightly tied together, not only neurologically, but actually structurally. So in this position, this is the position you would actually start off in. I'm not going to show everything, but my back is rounded. My back is rounded. I breathe into my back. I'm sensing my right arch and my left heel. Again, I talk about it in the video itself if you want the full length. And I'm just kind of expand my back with air. So I'm feeling my left back, my left lower and mid back, expanding into the wall as I breathe. What you cannot do when you inhale is pull your neck up. So I want to expand. I do show it eventually what a neck breath would look like. Come on, let's get to the neck breath. Neck breath. There it is. You don't want to do that. If you do that, forget it. It'll never work. So if you're in that position, you take a breath in, your shoulders do this, that's your neck. And that's a sticking point. You will never get your QLs to shut off if you keep using your neck to breathe up, because that just extends your back even more. That's extension. That neck has to stay off. And that's for a lot of people, that's why a lot of PRI techniques may or may not work, is because they cannot get their neck to shut off and they don't have enough guidance from people who know what they're doing to actually help get them to allow their neck to shut off. It's a whole nother animal. So I can't really get into it because, again, that would take a 50-minute, 60-minute, 300 videos because I have so many videos about this. But anyway, that's what you would have to do. First, you would have to get into a state of flexion, just like in that technique, and you would have to breathe and get air into that back, the left lower and mid back. Now remember, that was just the breathing aspect of the left QL. In order to start to stabilize the pelvis, or you have to start to stabilize the pelvis on this left side so that the left QL doesn't have to be overused for stabilization and doesn't get constantly dragged to the right. So when this left hip is forward, it has to learn how to go back. So this technique, this scissor slide technique, I did a video on this about 4 years ago. It is a Postural Restoration Institute technique. That technique teaches you how to use your left inner thigh, your left adductor, and your left hamstring to pull this pelvis on the left side, the ilium, back on the left, which teaches you to rotate your pelvis to the left so you can get onto your left leg appropriately. Now, fair enough. That's not too hard to figure out how to actually do that technique, and you'd want to watch the video to understand how to do it. But people may do that technique and say, oh, I know, I understand, I need my left hamstring, my left inner thigh to get this pelvis to go back on the left. Yes, you do. But what they may not realize is without the breathing component, it will not work. Because if you cannot get air into your left back, or you cannot expand the right side of your rib cage, the two areas that we just talked about, you will not be able to shift this left pelvis back because your rib cage is too tight. The rib cage has to accept the structure, where is it? The structure on top of the pelvis has to accept the pelvis moving back, which requires air to fill up the left back, which is what I just talked about. So, to get that pelvis to move back appropriately, you wouldn't want to start with the scissor slide technique, most likely. You'd want to start with the two techniques previously. So in order, I would go the standing wall supported reach, which was the second one that I showed, where your back is against the wall and you're breathing into your back. And that is to get thoracic flexion, to get air into your back first. Then I would go to the side-lying rest position to open up the right side of the rib cage, to get that right side of the rib cage to open up. And once those two areas are open with air, your spine and your rib cage will have the freedom to turn to the left with the pelvis. Everything has to turn to the left, not just the pelvis. So in order, I would go standing wall-supported reach, then I would go side-lying rest position, then I would go with the inferior, the lower right butt, right inner thigh stretch inhibition technique, and then the scissor slide. And that would be the order. Now, is that going to work for every single person? No, because they may have a neck that's way overactive. They might not be able to shut down their right inner thigh. They might not be able, whoops, that's my femur. They might not have the right shoes for their brain at this point in time. That's why I made a video about minimalist shoes. You'd want to watch that. You could do these techniques perfectly correctly, and then you get upright, and you don't have the right shoes for what your brain needs to sense the ground properly, whether it's minimalist or non-minimalist, you'll go right back into the pattern. I've seen it 1,000 times. You may not know how to do the techniques properly. So will it work for every single person? No, I'm already telling you, because everyone's brain is different. You might have a visual issue that you don't know about. You might have glasses and not wear them, and your brain says, I can't see too properly, so I'm just going to stay tight. You might have malocclusion. You might have anything. You might have had speech problems when you're young, and those speech problems are affecting your neck. You could have a tongue tie. You could have so many things, and that's where the science of postural restoration comes in. What is going on with this individual that is preventing this individual from getting to the left? If you have none of those things, yeah, it'll probably work. I've shown how easy it is to get their bodies to change and then start that restabilization process. Now, is that all you're going to need? No. You're going to need a full PRI program, which is individualized. You can't mass produce PRI because it's meant for the individual that's coming to see me, which is not the same as the next individual that comes to see me, because their traumas are different, their injuries are different, their shoes are different, their brains were just socialized differently. Some people are naturally happy, some people are naturally not happy. It makes a big difference. Emotion works on your brainstem, where all the movement and breathing is coordinated. So if you're tense or you're tight or stressed out, you might not be able to inhibit your neck. So it's not so simple, but if you're a relatively calm person and you got nothing going on with your cranium, it could very well start the process of restoring diaphragmatic breathing and restoring pelvic stability, in which case you should be able to do this eventually. So this is a little single leg stance test. It's something I use to see if people can inhibit the overactivity of their back musculature, of their QLs and other back muscles that stay too tight. If you can do it, it's most likely that those muscles are relaxed. So here I am, kind of quick. I'm on my left leg, and I'm touching my right big toe. I'm not cramping, and I'm breathing. That's on my left leg. Then I do it on my right side. Same thing. Right hand touching my left toes, and I'm breathing. I'm not holding my breath. That's important. People who try that, if they can't do it, they're going to hold their breath to stay stable. That's legal. That's fake stability. If you cannot touch your toe, that means your back is too tight. If you're just falling over and you can't stabilize yourself, well, that's a hip musculature weakness. On the right side, it'll be the right glute that's not active enough or not strong enough. And on the left side, it's going to be lack of a left hamstring, lack of a left adductor, lack of a left glute medius, and then overactivity of the back muscles. So that's a great test that I use with people, just as a rough understanding of whether they can actually stabilize on the right leg or the left leg. And if they can stabilize, then you know they probably have ability to relax their back enough to allow for diaphragmatic breathing.